If you're a woman and you've been diagnosed with fibroid, and you've been thinking this is what I did or this is what I could have done, there is absolutely nothing that you did that is causing this. Fibroid still remains a medical mystery. Nobody knows actually what caused this problem. And most women are diagnosed between the age of 30 and 50. So sometimes they think age plays a role in it, but that does not mean that every woman between 30 to 50 is going to be diagnosed of fibroid, but 60% of women are going to be diagnosed of fibroid in their lifetime. The only thing that doctors can think of or researchers can think of that could be causing this could be genetics. Like if it runs in the family, then there's a chance of somebody having it because somebody else had it in the family, or you're using like hormonal drugs. So because fibroid works with hormone, and the same way to treat it, you have to get like hormonal medication. But there's something you have to understand about fibroid, because I saw this lady who went through a major surgery to get rid of fibroid. A few days later, she had the fibroid came back. So sometimes that's why you have to talk to your doctor, and they'll have to give you options. Then you go with the one that you want. You could go for surgery, but they have to tell you that there's a chance of it coming back or not coming back. You could go the route of embolization, some type of embolization where they try to shrink it. You could go through taking hormonal medication, anti-hormonal, to shrink it. But if you want to go the natural way, so these are the things that your doctor will share with you, and then you make a decision on what you want to do. But if you want to go the natural way to shrink cancer, or to shrink fibroid, or to let it not to continue to increase in size, especially if you are diagnosed when your fibroid is in a smaller size, like 2 cm, 3 cm, 4 cm, and you just want to make sure that there are things you could do to be able to keep it where it's not going to continue to grow. You will be managing it. First of all, if you are done with childbirth, because some type of fibroid can hinder fertility. If you are done with childbirth and you have fibroid, it might not be giving you some problems, but if it is giving you some problems, you have to really consider taking it out. But if it's something that you could manage, which I believe your doctor will discuss with you, you have to make sure that you are making sure that you are staying away from certain types of food, and you are taking something that will help you. Something that helps, you have shown to help with fibroid, is green tea. Green tea and vitamin D has shown not to shrink the fibroid, but to keep it from growing. I've seen a lot of women who take green tea and vitamin D on daily basis, go back after 6 months or a year, and the fibroid is still that size. So that way it's not getting bigger, so it's not giving them serious problems of severe bleeding or pain or not. Then you could go that route. But for you to manage yourself very well, you have to avoid refined carbs, you have to avoid sugary drinks, you have to avoid alcohol, caffeine, you have to avoid red meat, you have to avoid high fat milk. Like milk, you can have like low fat milk. So dairy is not good. And some medications too, if you want to go medication route, you have to get like anti-hormonal drugs, but they have severe side effects. So make sure you discuss with your doctor, make sure you find out the side effects of these medications, and I wish you luck.